Welcome. We are the team number 8 from the group 101 from the topic of biofluids. My teammates are Valeria Stephanie Esquivel, Milton Ociel Candela, Daniela Alejandra Valdez, and my person, Damián Mateo Zúñiga. We are going to talk about biomedical devices for the prevention, monitoring, treatment, and rehabilitation of diseases from the vascular system. So I'm going to talk about ultrasonic equipment. I'm going to talk about the parts of the ultrasonic equipment later, but first we're going to center on this. What is the ultrasonic technique? It's a non-invasive diagnostic technique that reproduces images from the internal parts of the body in revision. How the ultrasonic equipment works and how it gets the measurements? We have two phases, emission and reception. Emission, it sends ultrasonic waves that bounces in the tissue, losing part of their amplitude depending on the material that they hit. Later, we alternate it to another phase, that is the reception, and it receives the waves back depending of the difference of amplitude that the transducer can know the distance that the wave traveled, and also like get a shape. It switches the phase again after a certain time, letting the waves come back, and it measures the structures within how clear is the image and how it seems. So now we're going to see the parts of ultrasonic equipment. We have a generator of pulses that generates electric pulses for the transducer. The transducer transforms the electric pulses to sound and vice versa. Then we have an analog to digital converter, a graphic memory, a monitor, and a graphic record. There are different types of transducers depending of the needing that we have. So they are sectorial, convex, linear, and intracavitary transducers. We have, what are the parameters? The parameters of ultrasonic, it's the sound, literally the waves that have to be between 3 and 15 megahertz. Yeah, we have pros and cons. The pros are that it is harmless, so it doesn't get damaged. It's fast and well tolerated. It's cheap. It allows repetitive controls, easy access, easy movement. It's dynamic because we see the image at real time, and it's reproducible. The cons are that we have limited vision, low specificity, and it depends of the human intuition to literally works, because the only one that can know it's the human that is seeing the image. The application is rheumatology, vision of traumatism, but chronic pathologies, and treatment of certain post surgery, and also pregnancy. So I give the next one to one of my.
Electronic transducers are devices that convert one form of energy into another, typically by using electronic circuits. These transducers are widely used in a variety of equipment, such as sensors, instruments, and control systems. The basis of equipment with electronic transducers is the ability to measure or detect a physical quantity, such as temperature, pressure, etc., and convert it into an electric signal that can be processed, analyzed, or transmitted to other devices. These electronic transducers can be designed to operate in a variety of environments, converting the physical quantity into an electrical signal. On the type of the it depends on the type of the transducer, but the main point is that the output signal is calibrated to provide a reliable and accuracy measurement, and the results are easy to interpret. The parameters of the device will help us to measure everything related with the type of equipment the user is using. In the blood pressure monitor, we consider six main parameters that fit to provide the information needed to diagnose an illness, which are the systolic and diastolic blood pressure, pulse rate, irregular heartbeat detection, hypertension indicators, and the multiple user profiles and advanced averaging. The electronic transducer allows the equipment to detect several pathological conditions related to blood pressure and heart health, lungs, and other parts of the human body. Here are some of examples of pathological conditions that can be observed, such as hypertension, cardiac diseases, diabetes, kidney or bladder stones, lung conditions, and among others. The blood pressure monitor in this case is a highly advanced and accurate device for measuring blood pressure, but like all medical devices, it does have certain limitations that can be avoided, but it's hard to control it, like a movement that the patient does can affect the measure. For example, despite all these limitations, the monitor is reliable and accurate and can also provide valuable information about your blood pressure and heart health. It is important to use the device correctly and consult with a healthcare professional, and if you have any concerns about your readings or overall health.
My name is Valeria Stephanie Galvan, and I'm talking about pneumatic devices. Well, these devices, including tools and instruments functionalities, are based on the generation of compressed air to transmit force and energy, where a small compressor activates to fill storage tank for intermittent use without returning lights. Well, the basic components of these devices is a compressor that makes air, a reservoir to store air, one or more valves to control the air, a circuit that moves air between the other components, and actuator or motor which uses air to do something. Pneumatic devices are mainly used in the medical equipment such as oxygen concentrators, infusion pumps, ventilators, wound therapy, blood analyzers, pressure cuff devices, the manometer, the breathable gas delivery systems, and anesthesia devices. While some parameters of this device, and specifically, is the accuracy, the tube diameter, chamber size, which is the one that wraps around the arm and depends on the sizes, and because of the patient, that might be different, and the inclination and conditions of the patient. Well, and how can things be measured with this device is the conditions of the patients to check the physical relaxation, wrapping the arm at the correct height, the palpation, placing the cuff, and inflate and deflate at a constant rate. But the instructions are clearly more like specific in the section below. Another pneumatic devices, but in this case with the can detect some other cardiac states of the patient, but in this case with the manometer, some examples of pathologies can be high blood pressure. It can damage your arteries by making them less elastic. Also, the decrease of blood flow and oxygen to the heart and leads to heart disease, causing a chest pain, also called angina. Also, arterial occlusion that can be classified into types of etiology, such as embolism, thrombosis, and arteriosclerosis, and artery diseases and pulmonary embolism, and also like you can infer some other states of the condition of the patients with the sounds of Korthoff. Yes, like as it said above, like no sounds, you can infer that an artery is occluded.
So as for imaging equipment with contrast media, well, the theoretical basics is that we use a contrast media, which are substances introduced into the body, and hence they block the ability of X-rays to pass through an area. As a result, blood vessels, organs, and other body tissues temporarily contain that contrast material change their appearance, hence they are more apparent, more precisely diagnose an injury or a disease. So according to the measurement, where there are certain type of measurements on CT scans, we can get coronary calcium scan in order to see the buildup of calcium in the arteries. Also angiography to examine the arteries that supply blood to the heart. Also, we can do a lung imaging test of the aorta and pulmonary arteries to look for problems, like for structural problems, without using the contrast media. Well, for parameters that are handled, there are a variety of parameters regarding the imaging device, but the parameters that change are depending on what you want to see on the device is the contrast media. Well, barium sulfates, for example, used for upper, medium, and lower digestive tracts. Ionic or contrast media for first generation, then non-ionic, and gadolinium is for magnetic resonance. So as for examples of pathological conditions that can be observed, there are a variety. Here I list on the pathological for CT scan. But for example, PET scan, it has different conditions that can be observed. For cardiovascular, well, the normal heart has heart and arteries that are normals in appearance and with low calcium score. When it says structural changes, we can detect aneurysm, congenital heart disease, and when you have another more, and high calcium score means buildup of calcium in the walls of coronary artery. As for limitations, well, for CT scan, we got they exposed to radiation for X-rays, and this can cause cancer, but also contrast media can cause also allergies, for example, nausea, vomiting, also anaphylaxis attack.